Haemophilia research has traditionally focused on patients diagnosed with haemophilia, and although interest is building in the global community, there is still a lot more we need to understand about the experiences and issues for the women who are carriers of haemophilia. CARES was a two-stage exploratory study into the emotional well-being and experiences of women diagnosed as carriers. Stage 1 used focus groups and individual interviews with 16 women to get information from women about their experience of being a carrier. We identified 10 themes in Stage 1, including early experiences of haemophilia in the family, responses to the diagnosis, self-perception, and coping style. This helped us design the questionnaire for Stage 2. For Stage 2, questionnaires were designed using the carrier's experience from Stage 1 of the study and given to a larger number of women to complete. They included questions about diagnosis, number of bleeding symptoms, experience of healthcare, and mood. A total of 226 UK residents responded to the questionnaire. Over half have 3 or more bleeding symptoms. What did we find? Only a quarter of participants were given written information at diagnosis that was easy to understand. However, nearly half were given a contact point for information, support, and advice. We found that about a fifth of participants felt that the way they were told they were a carrier should have been done more sensitively. 30% thought they would have benefited from further support in the 12 months following diagnosis. Many participants agreed that seeing family members deal with haemophilia has affected their emotional well-being, decisions about having children, guilt about passing on the gene, worry about their children's future, and the burden on the whole family. However, the majority of participants said that their carrier diagnosis has not affected their choices at all around health, relationships, occupation, or hobbies. On average, the participants' emotional well-being was similar to the general population, which suggests that being diagnosed as a carrier of haemophilia does not inevitably lead to higher levels of distress. However, it should be noted that none of these questionnaires were specific to haemophilia. What does this mean? Our study adds further support to the idea that women who are carriers have a specific set of currently unmet needs and concerns that could be best supported within a specialist service, as recommended in international guidelines. All those involved in the care of families with haemophilia should be working to address needs of women who are carriers. What can you do? Talk to your local haemophilia centre. Ask about information already available and help the centres to write it. Speak to the Haemophilia Society.